Well, I am thrilled to be here with you all to celebrate the day, World Patient Safety Day. I am a director of the Better Birth Program at Ariadne Labs and have been fortunate to work for many years in Uttar Pradesh with several colleagues at the Community Empowerment Lab, as well as colleagues at the Ministry of Health and Family Welfare and among others. So I'm thrilled to be able to introduce our distinguished panelists, and I think we have a slide set up, and I just want to make sure that that's ready to go. So as mentioned by Dr. Lallu and others, we have a series of presentations that's going to take place over the next hour, and we hope to share with you learnings around the WHO Safe Childbirth Checklist implementation and the efforts that have been done globally, particularly in India, but also in the region and with colleagues in Sudan. So I'm just providing a brief bio for each person so we can get to the panel itself. So I have Dr. Anuradha Pichumani, who you've already heard from today at CAHO. She's Executive Director at the Sri Ranga Hospital in Chengalpattu in Tamil Nadu, and we welcome Dr. Anu and her leadership around the checklist. We're going to have a conversation and you can hear their experiences with implementation. Some of these partners we've worked with for quite some time to understand what are the implementation approaches, strategies, and challenges. I would like to highlight, first of all, that Dr. Anuradha Pichumani, who's the one who helped set up this session, and I'm grateful to her, has been a champion of the Safe Childbirth Checklist in her hospital, in Sri Ranga Hospital in Tamil Nadu. And she's a leader in expanding the checklist through CAHO and this wonderful partnership that you all have just announced, and we're thrilled to see this moving forward. So Dr. Anu, I wonder, can you share with us a bit about your motivation for why you chose to adapt and implement the checklist, and what some of your planned efforts are underway with CAHO to support checklist use in India? Dr. Anu, I'll turn it to you.
Thank you, Dr. Katherine Semrau, and good evening to you all. To answer your question, Sri Ranga Hospital is a 30-year-old multi-specialty hospital. And to give you a bit of background, it caters to the semi-urban and rural population of Chengalpattu district in Tamil Nadu in southern India. And over the initial part of our 20 years, the focus was on capacity building of the hospital and expansion of its services. In the past 10 years, we have undertaken various quality initiatives, prioritizing patient safety. So earlier, we had adopted and implemented the WHO surgical safety checklist in 2010, and we are very happy with the value addition to our clinical processes. So this positive experience helped us to again look into the various clinical processes and improve on the quality tools. So being an obstetrician, I wanted to continually improve ourselves in this domain. And this WHO surgical safe childbirth checklist has been easy to adopt, easy to modify, train, and also easy to implement among low resource settings too. So we have now added 40 new elements to the safe childbirth checklist in our hospital and have trained our staff on the various processes. And since we found it to be a very useful handing over tool to reduce the medical errors inside the hospital, and this has been a big motivation and a good incentive for us to adapt and implement this safe childbirth checklist. So this has been a great motivation, and we have seen the change in the hospital last 1.5 years from the day we started implementing with your team, with Dr. Rose Molina and Dr. Katherine Semrau and the whole staff. Thank you very much. And coming to CAHO, so the second part of your question was on CAHO. So CAHO is committed to strengthening patient safety through skilling of staff in various clinical and non-clinical functions throughout the healthcare industry. And as the chairperson of the Quality Professional Wing of CAHO, and as an obstetrician, I would like to thank the President, Dr. Vijay Agarwal, and the Secretary General of CAHO, Dr. Lallu Joseph, for taking up this cause of WHO Safe Childbirth Checklist in this World Patient Safety Day event. And again, through CAHO, we are collaborating with various clinical societies. Now, as we did our launch today, the Royal College of Obstetricians, the India Committee, and where we are going to do a baseline survey of the safe childbirth checklist usage in the various hospitals across India. And then we are going to evaluate whether there is an interest among the hospitals to adopt the SCC. And also we are going to develop a time frame for the implementation of safe childbirth checklist after the initial survey. And now we are moving forward. We are also discussing with the president of OXI, the Obstetrician and Gynecological Society of Southern India, regarding a plan to jointly promote the WHO Safe Childbirth Checklist among its members in the southern state, in Tamil Nadu specifically. And since this checklist has created a huge interest, more so because of the theme of this safety day. So KAHO will be promoting it with various government and private teaching institutions and medical colleges across India, where we are planning to promote this WHO Safe Childbirth Checklist. So we hope to get it forward still. Thank you so much. Thank you for that.
Excellent, Dr. Anu. I think there's, a wonderful opportunity here with World Patient Safety Day to this launch. I mean, the things that you all have been doing here on this session today, but globally there is a movement around the need for safe maternal newborn care, and it needs to be respectful and high quality care. And I think some of the things you just highlighted about this collaboration coming together, so it's not just in the public sector, it's also in the private sector. I think one of the things we've heard is this idea that it can work in a variety of settings and environments. And I think that's one of my key messages. It doesn't have to be a state-of-the-art hospital, and it doesn't have to be a small maternity home. The Safe Childbirth Checklist can work in any setting because the adaptability is key. Dr. Anu, there's one final question about how can KAHO engage with addressing the SDGs and achieving our goals around maternal and newborn health, and then I'll wrap up after your answer.
Thank you for the question, Dr. Katherine. So KAHO is taking up various collaborations across the world now. So we will be able to improve on these quality improvement initiatives, be it FOXY or other initiatives in various other countries also, particularly in low middle income countries. So we have now our presence in ASQA, the Asian Society for Quality. So in ASQA, we have our own board members in ASQA, and we would like to take it across the world. And again, within India, we would like to improve on these various quality improvements so that we can try to achieve the goals. So to reduce the maternal mortality and the neonatal mortality. So we definitely try to do it with the help of various collaborations. We take it forward.
Wonderful, Dr. Anu. Thank you so much for your dedication to this work. And I just want to take a moment to say thank you so much to our expert panelists for joining in this wonderful discussion from around the world. Literally all time zones are covered right now. And I want to highlight that, of course, this dedication to World Patient Safety Day and your dedication to achieving safe and respectful childbirth and safe and maternal and newborn care is inspiring to me and the work that I do. But I believe that this panel has been helpful in identifying that it's not always an easy road, but it is definitely progress can be made. Again, I want to thank the leadership for inviting me and allowing me to moderate this panel. It's been really a wonderful experience. Namaste.
Thank you. Namaste.
Thank you so much, Dr. Katherine. Indeed, a wonderful session. It's overwhelming to hear from so many experts across the globe and their experiences, the challenges. And from KAHO, as Dr. Anu said, we are the consortium of accredited healthcare organizations in India. We have excellent stakeholder base, quality professionals, doctors, nurses, administrators, who are very passionate about quality and patient safety. So we are sold to the idea of promoting this safe child checklist. And this year we are going to be taking this as our agenda to motivate more and more hospitals join the journey, and we are very sure that we'll be able to promote this in a big way in this country. And as Dr. Anu said, our partnership is growing, and we'll be able to certainly have training sessions conducted across the country. We are really committed to what we are talking about today, and next year let's all meet together and see the success and where after 365 days, where have we gone? So that will be a good thing to look forward to. And thank you for sparing your time. Wonderful session. And thank you for all the panelists for sparing your time and your experiences.